The translation into effective products, from my point of view, is to take something that's proven, the best in the world, depending on how you look at it, definitely the best in the United States, and you bring 10 years of excellence, 10 years of healing, 10 years of science. Two of the top dermatological vets in the world, the pioneers. And you bring all that together and say, this is for your pet. This is something that is good enough for your pet. We have a saying that I really like, tested on humans, loved by pets. So we just started the other way around. We've built a safe line for humans, an effective line, and I'm thrilled to have that same science for the pets.
We've seen tremendous changes in our approach to how we treat dogs and cats with skin disease. And when I first started, topical therapy was not commonly used. It was very limited in scope. And today there's numerous companies who are coming out with products for topical therapy. And as a specialty and as a science, veterinary medicine has learned that topical therapy has a lot of value.
As a dermatologist, I've been exposed to lots of different topical therapeutic lines over the years. Certainly things have changed dramatically, and my involvement with Pinnaclife stems from relationships knowing Dr. Darlene McCord personally for over 15 years and seeing what she's done on the human end. I'm very excited to be involved with Pinnaclife, branching into veterinary dermatology.
We're committed to healing. We talk about it. And to develop a line of products that are good enough for these two is a great challenge for me. To know that you went to the top people and said, I'd like to bring my human healing to companion animals. That would be a dream. But it has to be good enough that you think it's good enough. It has to be unique enough that the best in the field would attach their name to it. Are you ready to take the journey with me?
The Pinnaclife line, particularly with the incorporation of livamine in all the products, to me is exciting because of its antioxidants properties, which haven't received a lot of attention in veterinary medicine, as well as the fatty acids that are in there to try to promote improved health of the skin. I think when you consider all the different skin diseases we deal with, those are ingredients that have a lot of potential for what they're going to do for our patients long term, without having the risk of using some of the other anti-inflammatory and antibacterial agents.
Whenever you're dealing with diseases that have so many different variable underlying and contributory etiologies, we often then rely on multimodal therapy, meaning that we often use multiple different forms of treatment. And what's nice about this particular product line, it actually incorporates a lot of different ingredients that approach, on a topical end, a multimodal approach.
A product should be able to do a couple of things. And what I find is sometimes people make these big extensive lines and I go, why? Why don't you just get it all right in a single product? You're a formulator. Build it in. Let it do more than one thing. It's all you need to get a pet back.
The medicated ear cleansers are valuable for pets that are suffering from mild to severe cases of otitis or otitis externa. This product is very safe and mild and can be used in irritated ears or ears that have secondary infection. The product contains very mild ceramidolytics and drying agents and works very nicely and doesn't necessarily have to be entirely removed from the ear canal after application.
The ear products by Pinnaclife are the type of products that I feel comfortable using long term because they don't contain the ingredients that we associate with risk with a lot of our more potent topical ear products. And so for those dogs prone to recurrent ear disease, these are the type of products that when used regularly can prevent those flare-ups and stop dogs from needing the more potent medications.
The medicated ear hydrogel is a hydrocortisone-based product, and hydrocortisone, when combined with a number of the other natural ingredients in this product, has a synergistic anti-inflammatory effect. And many of the ear conditions we see are complicated by pain and itching and inflammation. And so besides having anti-inflammatory effects, the product also has a very nice antiseptic property to control bacterial and yeast overgrowth.
The medicated ear gel and the medicated ear cleanser have been beneficial in a number of our cases to control the long-term recurrent otitis that these animals were prone to.
Antipruritic shampoo is an extremely valuable product to use for a very common presenting problem in animals with skin disease. Allergic hypersensitivities is the most common condition that veterinarians see, and it's often associated with pruritus, which manifests in itching, scratching, chewing, and biting. This product contains witch hazel, which is a natural analgesic, combined with a number of other moisturizing and antipruritic properties, and produces a very nice, desirable clinical result.
We do see some dogs that if they're bathed regularly, we're getting a decrease in their allergic signs with the antipruritic shampoo.
The antipruritic spray is valuable to treat localized areas of pruritus. And this is, again, very common in allergic skin conditions, particularly atopic dermatitis. Pets will commonly chew and lick at their paws or their feet, and this product can be used to alleviate pruritus in this location. It's also valuable to treat areas of what are called hot spots, which are acute pyotraumatic areas that pets may chew very intensely, and this can help alleviate some of the inflammation and pain associated with such lesions.
We've had some cases where putting the antipruritic spray on dogs that are primarily licking their paws, they'll leave those paws alone for a period of time, which gives a good benefit to try to allow that skin to heal.
The Wound Shield product we have been extremely impressed with. This particular product has been utilized to treat localized areas of infection. In particular, we've had value treating localized pyoderma, acrolick dermatitis, or so-called lick granulomas, and any area of intertriginous or focal areas of infection or bacterial or yeast overgrowth.
Normally I have to use systemic antibiotics. I've had cases where using the Wound Shield and possibly in combination with the antipruritic spray has kept those animals from licking those lesions that normally they were going after constantly, and ended up in the lesions resolving and clearing up.
The deterrent antipruritic spray contains a natural deterrent to prevent pets from licking and chewing more extensively. So products such as this may be utilized in more intensely pruritic lesions. The deterrent in the Wound Shield product is valuable in that many of these localized areas of infection can also be intensely pruritic or itchy. And by having the deterrent, it allows the product to stay in contact with the infected lesion longer, so the pet is less likely to lick or remove the product in the process of the healing.
They kill a number of the known pathogens in the dog in under 3 minutes in a laboratory condition is certainly encouraging, because if that transcends and applies to the clinical situation, which based on our clinical use it appears to, but if it truly works as well in the patient as it's doing in the lab, then that's an exciting way to try to control these infections without having to use antibiotic therapy.
Avoiding the use of antibiotics until they're really truly necessary is certainly a goal of many of the physicians currently, and topical products with antiseptics are a better approach in general.
I can put a combination, and it takes a combination of natural ingredients together, and I can be as effective on some pathogens as an antibiotic.
The Pinnaclife human line has been one of the more successful lines in human wound healing and topical health care. And certainly having that background is a huge benefit, bringing it into the animal or veterinary dermatology field. The science that's been required to achieve success in human medicine taking that same success and the active ingredients into a veterinary product line is huge.
The initial experiences with it have been very rewarding, which makes me excited to continue working with it.
When we studied these products in animals, we looked at animals that had had serious skin disease for 10, 12, 15 years. Very serious problems. Animals that nothing else worked on. We didn't take the easy patients. We took the challenge. We took the hardest patients and we gave them relief. So Alevamine does heal when nothing else does. The line is simple, it's compact, it's affordable, and it works.